What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is your first time, don't forget to subscribe. And what a beautiful moment this is to have an overview of the bones of the cranial cavity. So the cranial bones is the topic of discussion today. But before we dive into details of the cranial bones, it's always nice to go back to square one, to discuss about the skull, the bony framework of the head. So the skull is also called cranium, and is the bony framework of the head, and is a part of the axioskeleton. The skull is divided in two main parts: the neurocranium, which encloses the cranial part of the central nervous system, which is the brain, and the visceral cranium, which encloses the proximal end of the respiratory and the digestive system. It's called the visceral because it covers part of the viscera, and to be specific, the proximal part of the respiratory system and the proximal part of the digestive system. Now, if you smash the skull, you see you have 22 individual bones. This is to exclude the small bones within ears, which are called the ear oscles. And now you can remember your malleus, incus, and the stapes. They are not included here. And we have 3 on this side and 3 on the other side. Don't count them in the bone of the skull. And out of these 22 that are forming the skull, 8 of them, they are forming the so called the neurocranium. And so these 8 bones are referred to the cranial bones. And then the rest 14 to make 22, they are forming the visceral cranium, and which is also and for which these bones are also referred the fascial bones. So we have 8 cranial bones and 14 fascial bones. If you can remember, our topic of discussion today is the cranial bones. So forget about fascial bones. We're going to have a separate discussion on the fascial bones and overview in each one in turn, but today is the cranial bones. As we have said, the primary function of these cranial bones is to protect the brain. They're forming the house, to house the brain, and because they're housing the brain, they have a cavity within it, which the brain is sitting, and this cavity is called the cranial cavity. So the cranial cavity is the cavity within this cranial bone to which the brain sits. The brain sits in the cranial cavity. Okay, now we're going to discuss each one in turn. Each one of the, to have a picture of this bone in turn. And this one, the first bone is called the frontal bone, which is a frontal, found anteriorly. And then we have 2 bones which are called parietal bones, one on this side and one on the other side. The word parietal actually means the wall. Why wall? Because it's believed these bones, because they're laterally pressed, they are forming like the wall of the cranial cavity. Okay, and then we have another bone which is posteriorly placed and found on the occiput, and it's called the occipital bone. We have another bone here which is called the temporal bone, and the word temporal come from Latin tempus, which means time. Why is this bone related to time? It was believed that gray hair is starting from this region, and so if you find someone has got gray hair here, is a sign of aging. And so this is why this region over here is referred the time region. It's region that signifies change in age, and so it is called the temporal region, and the bone that is found there, it is called the temporal bone, and this is your temporal bone. We have another bone here which you are seeing only part of it. It's called the sphenoid bone. Sphenoid bone is this bone over here, but we are seeing only the greater wing of the sphenoid bone. We're going to discuss it. I'm going to show you what it looks like, and then this is just a part of it. And to wind up on the superior view, you can see we have 1 frontal bone, 2 parietal bones, and 1 occipital bone. So only 4 bones can be viewed from superior view. And if you go to the smashed version of the cranium, you will see we have 1 frontal bone, 2 parietal bones, and we have seen occipital bone, which is found posteriorly, and we have also seen the temporal bone, the time bone, bone that signifies change in time, aging. And this is the temporal bone. And now we've also seen this bone here, which is called the sphenoid bone. We've said that only part of it is observed on the lateral surface, on the lateral side, and this is the sphenoid bone. We only have 1 sphenoid bone, and it spans laterally, and we have the wings that are spanning laterally. Now, if you count 1, 2, 3, 4, 5, 6, 7, how many bones do we expect from the neurocranium? 8. So where is the last one? Well, the last one is called the ethmoid bone. And for you to be able to see the ethmoid bone, you have to smash the cranium. You cannot see it from glance because it is found deep within other bones, and it's called the ethmoid bone. We're going to see a picture of each one in turn. At least the unique ones. And then this is the first one, which is called the sphenoid bone. And the word sphenoid actually means the wedge shape. This bone is wedge shaped and this butterfly shape. Is one among the beautiful bones, in my opinion. One among the beautiful bone. What bone it is? See, it has got the wings, and this is the greater wing, and the greater wing is the one which is observed on the lateral, on articulating with the temporal and the frontal bones on either side. The sphenoid bone is very, very unique of the bones of the cranial cavity. Why? Because this is the only bone of the cranial cavity that articulates with all other bones. Remember, we've said we have 80 cranial bones, and sphenoid being one of them means it articulates with 7 other bones. 7 other bones. It sits here in the center. It's considered a keystone. We're going to discuss sphenoid bone at some point. We cannot take it in for granted at this moment. No, we have a separate discussion on sphenoid bone, and you can count on it. And then another bone we've said that is not seen from outside is called the ethmoid bone here. And one among the beautiful feature of the ethmoid bone has got this beautiful impression here, which is called the crista galli. We're going to discuss also about the ethmoid bone as a separate session. We're going to have a separate session talking only about the ethmoid bone. And also have a bone which is out posteriorly placed here, which you said the occipital bone. This is the occipital bone. In Swahili I think it's kichogo. You guys know the occipital bone. It forms part of the back of the back of the head. Now to wind up, we've said we have 8 cranial bones, and we've said some of bones are found like on either side, and some of them are only found like centrally located or something like that. So we can be divided. These bones can be divided into paired bones and unpaired bones. And the paired bones, we have said we have 2 parietal bones, one on this side and one on the other side, and the two temporal bones, one on this side and one on the other side. So the remaining 4, they are unpaired. Remember, we have the frontal bone. We only have one frontal bone. We only have one occipital bone. We only have one sphenoid bone, and we've seen only one ethmoid bone. For you to be able to see the ethmoid bone, you have to smash the cranium for you to be able to see. Now that we have seen these bones are forming the housing of the brain, now they have to be connected to one another, correct? And how are these bones connected to one another? They are connected to one another by special joints which are called sutures. And the word sutures mean sewing. Why sewing? Because they have zigzag like lines. So sutures are fibrous joint. They are fibrous joint. Remember, we discussed about them when we were doing anatomy, the element of arthrology. And we say the primary function of sutures, at least in adult, is to act as the shock absorber. But we know in children we have also sutures. They act as shock absorbing areas because of the presence of the fibrous membrane. Now, some of these sutures have got special names, and they are must-know sutures. For example, a junction between the right parietal lobe and the left parietal lobe, we have a suture here, and this suture is called the sagittal suture. Why sagittal? Because it's in the sagittal plane. Another important suture to remember is this suture between the frontal bone and the 2 parietal bones, like spanning from the front, between the frontal bones, the frontal bone, the 2 parietal bones. This suture is called the coronal suture. And why is it called the coronal suture? Because it's like the crown. So it cuts the head like how the crown cut the head, like anterior posteriorly. And this is why we also have the coronal plane, because of it is crown-like shaped. This suture is called the coronal suture. And then we have another suture here, which is called the lambdoid suture. Listen to the word lambdoid suture, because it is lambda-like suture. This suture is lambda-like. You guys know what lambda is. Lambda is 11th letter in Greek alphabet, and you see the shape. And this suture is called lambdoid because it has the shape of lambda. You see, it has the shape of lambda, and it's called the lambdoid suture. On the lateral side of the the cranium, we can also have some other sutures. For example, suture between the parietal bone and the temporal bone is called the squamous suture. And we'll have this part of the temporal bone, which is called the squamous part of the temporal bone. Don't worry about it. We're going to discuss also the temporal bone as a separate discussion. But the joint between the temporal bone and the sphenoid bone is also called a spheno-squamous joint or junction or suture. Spheno-squamous suture between the sphenoid bone and the squamous part of the temporal bone. And lastly, a joint between a suture between the frontal bone and sphenoid bone is called sphenofrontal suture. Now, we have a very important region here, which is called the Pterion. Which is called the Pterion. Pterion is a head-shaped region here of the head-shaped region of the cranium, which is formed by 4 bones, namely the frontal bone, the parietal bone, the squamous part of the temporal bone, and the greater wing of the sphenoid bone. The greater wing of the sphenoid bone. Why is this region important? This is the weakest area of the skull, the weakest point of the skull, not the thinnest. Remember, not the thinnest, is the weakest point. Why weakest? At least we have bones which are meeting here. We have like 4 bones which are meeting here, and they are forming like a weak point. So it's easy to fracture this. The skull is easy to fracture at this region because the weakest point. So even in low amount of energy, lower energy, bro, it can result into fracture of this region, which is called Pterion. And what is the clinical repercussion? Well, deep to the Pterion, we have an artery which is passing there, which is called the middle meningeal artery. So if you have fracture of the Pterion, it can result into rupture of the middle meningeal artery, resulting into life-threatening situation or condition, which is called epidural hematoma. We're going to have a discussion of epidural hematoma again. Don't stress about it. But that's no region of the Pterion is very weak point, and the weakest point of the skull, and doesn't mean it's the thinnest point of the skull. It's the weakest because we have bones which are going there to form a joint. So it's a joint. It's not covered by bones, it's covered by joints. So it's the weakest point of the skull, and damage to it, even low amount of energy can result into injury, serious injury, fracture, which result into life-threatening situation, which is called epidural hematoma. Now, if you see from inside the skull, you can see this is the region which is called the Pterion, formed by 4 bones: frontal, parietal, temporal, and sphenoid bone here, and is the weakest point, and is related to the branches of the middle meningeal artery. And so damage to this region, fracture to this region, can result into rupture of these vessels, resulting into building of blood, which is called the epidural hematoma. Now, going back to sutures, we have a lot of sutures, and these sutures are present from birth. Like, the baby's skull has also got sutures, which are separating different bones. And we say in children we have sutures at least because of 2 main reasons. Number 1 is to allow easy passage in the birth canal, the head of the baby to be accommodated in the birth canal, and we need to have the skull which is compressible. It can be compressed, and if it was rigid, it wouldn't be easy to pass in the birth canal. It wouldn't be compressible. But because of these sutures in babies, the bones are separated from one another, so the head of the baby is compressible and can be compressed to allow easy passage within the birth canal. But also another important thing we said when we're doing anatomy of the element of ethology, we also mentioned something like to allow easy growing of the brain. Like, the brain is at some point we need to grow, and if we have the rigid skull which is already the sutures are already fused, meaning the brain would not be able to expand. It would be confined within the skull. So sutures in children, two main things. Number 1 is passage in the birth canal, and number 2 it to allow rapid increase in the brain, rapid growth of the brain. Now, another important thing in the cranium, the skull of the babies, is that they have 2 frontal bones. They have 2 frontal bones. In order to have seen, we have only 1 frontal bone, but in children we have 2 frontal bones, and these bones are connected by suture here, which is called the metopic suture. Metopic suture is separating 2 frontal bones. But we've seen we have different bones of the skull, and these different bones of the skull, they will meet at some point. But when they're doing so, there are gaps which are left in between, and these gaps are called the fontanelles. Fontanelles are the gaps which are left when these bones of the skull are meeting, like different bones are meeting and leaving a gap, and these gaps are called fontanelles. The word fontanelles means little fountain. And why little fountain? Because of passing like activity of this fontanelle. The fontanelle also, they are not covered by bones, and so they are also referred as soft spots. the soft spot, because they're not covered by bones. And you know, in children you can feel they are very very soft, and you know, sometimes scary. The presence of fontanelle is a typical, like, is anatomical feature of the baby's skull. The skull of the newborn should have fontanelles. Should have fontanelle. We have a lot of this fontanelle. We have some of anterior fontanelle. This is anterior fontanelle, posterior fontanelle, and then we also have fontanelle on the lateral side. On the lateral. So a baby's skull has got a total of 6 fontanelles, but 2 on this side and 2 on the other side, and then the superior one will have the anterior fontanelle and the posterior fontanelle. So this is anterior fontanelle and this is posterior fontanelle, which are very very unique, and we're going to discuss about this. We forget about all other fontanelle, discussing about these two important fontanelle, anterior and the posterior fontanelle. So the anterior fontanelle is diamond shaped. As you can all see, it's a diamond shaped, and it's expected to close at the age of 18. Most books will tell 18 months, but it's a range. You will write 18 in an exam, but remember it's a range between 13 months to 24 months. It can close an anywhere in between, and that's it. Okay, what's the clinical repercussion? What's the clinical significance of the anterior fontanelle? The anterior fontanelle, it can be used as a clinical landmark to monitor the pressure within the cranium, intracranial pressure. So if we have elevated intracranial pressure, the anterior fontanelle can bulge. So we have bulging of anterior fontanelle in conditions like hydrocephalus, which is starting to increase the cranial pressure, but also meningitis and some other pathologies. And it's very very important. If you find your baby has got bulging anterior fontanelle, you can always seek medical attention, because it signifies something is going on, resulting to increase in the intracranial pressure. Pressure within the cranium is increasing, and then it can also be used to monitor the hydration status. If it becomes sunken, it goes down, it signifies probably dehydration, and severe form of dehydration can result into sunken fontanelle. But we have said the average duration of closure of this fontanelle is 13 to 24 months, but to some people it might be delayed. The closure might be delayed, and conditions like leakage and hypothyroidism result into delayed closure. Don't worry about these conditions, but just like you can have delayed closure. And this region is also very important for drawing the fluid within the brain. We have a fluid within the brain which is called the central the cerebrospinal fluid, CSF. And so at some point we need to drain this fluid, either for investigation purpose, like to go to check them in the lab, or for treatment purpose, to relieve the increased intracranial pressure. And this procedure is called ventricular tapping, and the ventricular tapping is made possible by the presence of this fontanelle. If you have the closed fontanelle here, it's difficult for you to tap, because how are you going to go through the bones? It's difficult, right? That's the anterior fontanelle. Now time for posterior fontanelle. The posterior fontanelle is triangular. The anterior fontanelle was diamond shaped. The posterior fontanelle is triangular shaped, and it closes earlier than the anterior fontanelle, and it closes about 6 to 8 weeks, not months, weeks, and which is, we convert is 2 to 3 months. The posterior fontanelle is very important for monitoring the process of labor. During vaginal delivery, the mama is delivered in vaginally. We are utilizing this posterior fontanelle to monitor the position of the baby, because we do not know how the baby is coming through the pelvis. So we are palpating. You are putting your fingers, doing vaginal examination, putting your fingers to feel for this fontanelle, the posterior fontanelle, and it should feel triangular. So you find that this triangle is this posterior fontanelle, which is triangular, is located on the posterior part of the mama pelvis. The head of the baby is facing anteriorly, because this is posteriorly, okay? And if you find this is anteriorly, means the head of the baby is facing posteriorly. Don't worry about this thing. I mean, just know it's used to monitor the process of labor during vaginal delivery, and this is very very important. But it can also be delayed. We can also have delayed closure of this posterior fontanelle in conditions like leakage and hypothyroidism. And we have seen already this one. We have within the cranial cavity, within the bones of the skull, we have some air fluid the air-filled spaces which are found within the bones of the cranial cavity. So these air-filled spaces are called the paranasal sinuses, air sinuses, or paranasal sinuses. And the function of this paranasal sinus is to lighten the head, to make the head, so I mean lighter, a little bit lighter, and to decrease the weight of the skull. This is very, very important. We're going to have a separate discussion of this paranasal sinus. You cannot take it for granted, but they are called the paranasal sinus because they are, revolving a lot. I mean, they are adjacent to the nose. Para means, around or surrounding, and the nasal means, nasal means the nose. So they're called the paranasal sinuses here. They are very, very important. We're going to have a separate discussion about this one, but the primary function of it is to brighten the brain, to brighten the skull, to make sure the skull is, lighter, and to balance, the biomechanics the biomechanics of the exoskeleton is very complicated, but at least the skull is made lighter by the presence of these air sinuses. But another important thing about this paranasal sinus is the resonance of voice. Remember, you can at some point, if you pinch your nose, you see one like nasal breathing and nasal speaking, right? Why? Because we have closed the communication with these paranasal sinuses, and so we don't have that resonance of maybe the resonance of the voice is altered, and these are called the paranasal sinus. We're going to have a separate discussion about it. But also these nasal sinuses, the paranasal sinus, they warm the air you are inhaling. Remember, you are sometimes in a cold situation, cold environment, and so we are inhaling a cold air. So it's been warmed by the presence of these paranasal sinuses. Very, very important. We're going to have a separate discussion about it. But they can become inflamed infected in a condition like sinusitis. We're going to discuss about it at some point. We have a very, very important thing which is called the frontal bossing. The frontal bossing, this is the prominent protruding forehead, which is mainly due to overgrowth of the frontal bone, or sometimes over thickening of the frontal bone. This is the clinical sign, and it's not a disease. It's a clinical sign, it's not a disease. Obongo, they call it what? Common. Now maybe it's I don't know if it's that right way, but it's not a disease, but it can be related to some other diseases, like if it's some congenital malformations and some other endocrinological disease, like disease of hormones. This sounds like pretty much it, and if you enjoyed this discussion, don't forget to share this discussion with your friends, and like this video, share it with your friends. But if you have question, additional comments, you can always write your comments in the comment section, and see you very soon.